Hi, I'm Dr. Tim Dugan, and I'm happy to be part of this team of people presenting on a child's psychodynamic psychotherapy. You'll see in the video clips that we use that I'm there as a younger resident, a second-year resident fellow in child and adolescent psychiatry. So I did this as part of my training, and there was a group behind a one-way mirror that watched me. We consulted with each other after every session. The reason why we chose this video for the purposes of demonstrating a psychotherapy with a child is that it's part of 40 hours, each of which were videotaped, and then they were condensed into 5 separate sessions spanning the length of the psychotherapy from session 9 to a termination session. Most of us know, as we are in our training, that we're using video more and more, but in general they're from like segments from an individual session of psychotherapy. This has to do with spanning one psychotherapy over 11 months from beginning to end. So we hope that you share our belief that it'll be more demonstrative of some of the issues. The boy that I'm treating, John, his symptoms began when he was 3.5 years old, and by the time I started to see him, he was 3 years, 11 months. And the weekly sessions of this treatment end when he's 4 years, 10 months old. He lived at home with his single and twice divorced mother, who's 30 years old, an 8-year-old half-sister, and a maternal grandmother. His father drove a motorcycle and was a construction worker, and lived with the family for very brief intervals when the patient was 5 months of age and 24 months of age. The parents had been formally divorced since John was 2.5 years old. The parents had been to court some 50 times around custody and visitation issues, mostly initiated by the father and seen primarily as his way to be revengeful and vindictive. So the chief complaint, John was brought for an evaluation, like I said, 3.5 years of age. He had developed very abruptly an acute fear of all men. The symptoms began abruptly 1 month before his first appointment, following a very rare weekend visit with his father. During the visit, the boy sustained a minor bone fracture of his right foot. The father denied any physical abuse of the child and denied witnessing any accident or fall. Following discovery of the fracture, the boy told a very confusing story of jumping on a couch. The boy could not elaborate on the details. You'll see a repetition of this story within the taped excerpts of the boy's psychotherapy, in which the boy, the psychotherapist, me, or the Superman figure is hit by a rolled or thrown marble and then falls down injured. So the history of the present illness. In the 5th month of the pregnancy, the father allegedly physically abused the mother. In the 9th month of the pregnancy, the father stole all of the mother's furniture from her home. Upon the child's delivery in the hospital, the father visited the hospital and threatened to kidnap the boy and drive away with him on his motorcycle. At the age of 3 years, 8 months, while the intake was being conducted at the clinic, the father visited the home and forcibly separated the child from the mother, pushed the mother down the stairs in the presence of the child, and drove away from the home with the child holding onto his back on the back of the motorcycle. You will hear in one of the videotaped excerpts the child tell me about this incident in scary and graphic detail. In terms of the past medical history, all of the developmental milestones were considered to be normal. The only thing relevant for these vignettes is that he did have a tied tongue or a shortened frenulum at birth, and that the frenulum was cut at 6 and 12 weeks of age. You'll see that his articulation is compromised in the beginning vignettes, and at the end, though, you'll be surprised to see that his articulation is much improved. The context of the treatment. It should be noted that the question of paternal custody and visitation was an open question during the first year of this boy's treatment. I never met the father, though I offered to meet him on several occasions. During the 13th month of treatment, the court did terminate paternal rights. I was able to convey my thoughts about John and his feelings about his father through a court-appointed evaluator. The setting was in an academic medical center. There was a blackboard, eraser, and chalk in the room that we used for treatment. While he drew a little on the board, John was more interested in clapping the erasers and making what he called smoke from the chalk dust. He made smoke when he was showing his what we came to call dragon feelings. He was worried that he could hurt me and that I was afraid of him. Literally, the chalk dust would cause us to cough, and it created physical distress which we endured together. So in these video excerpts, I should just tell you, when I first met John, it would be fair to say he was quivering with anxiety. He was unable to separate from his mother for the first 3 sessions, though was quite eager to get close to me and use the dollhouse and puppets. When he finally did separate, he would shoot out of the treatment room at the first hint of conflict, visit his mother, who was seen by one of the clinic social workers down the hall. He was very cute, imaginative, and expressive, though his articulation disorder early on was quite evident and distracting. By the 4th or 5th session, the other side of his ambivalence became quite obvious. He would walk up to me, take my hand on our way to the office, and say something like, "Dr. Dugan, you are funny." And he'd have a big grin and a very inviting look on his face. He made it clear that he wanted to get close and be close, yet was scared of these wishes. By the time the 9th session occurred, which is the first session that you'll see in the vignettes, he was able to readily separate from his mother and play with some other kids in his home neighborhood. He continued to recoil from strange men, but would not be overcome by the same level of panic.